Hi, my name is Dr. Shine, orthopedic consultant and sports medicine surgeon at King's College Hospital, London. Yes, I think lots of people see as us as surgeons very busy lifestyle, work, surgeries, commitments to clinics, and of course, probably you've seen a lot of my day and time is spent on patients. So, we have 5 cases in total today. The first case is an arthroscopy of the knee. Next is an arthroscopy of the knee. The third is an arthroscopy of the knee. Fourth is a shoulder arthroscopy, another shoulder arthroscopy, and I think that's about it.
My condition had a lateral tear to the meniscus in my left knee, damage to the cartilage. It's a result of wear and tear. Over the past 10 years, I had a previous procedure similar to the one Dr. Shine performed, and it degraded over the course of 10 years.
I landed on my knee and I immediately heard a noise. I couldn't get up on my own. People had to help me to get to a corner. I rushed myself into a hospital and the doctor said everything was fine, but he advised me to go and take an MRI, and that's when I realized it was a 3rd-degree tear, a complete rupture of the ACL.
I've teared up my knee when I was doing some workout at home.
So, I think I'm going to start scrubbing, shall we?
Six months ago, so early December, I sustained a sports injury. I fell down and injured my shoulder. So once that happened, I was in quite a lot of pain, and when it didn't improve over the next couple of days, I thought I needed to take orthopedic opinion.
Ibrahim, you okay? To the notes, do mention about the discoid. Yeah, and it was absolutely fine. There was no tear, so we didn't have to do anything about it. I'll see you shortly.
This is calling from King's College Hospital, Dubai Hills. This is Greta with you from Dr. Shine's clinic. I would like to inform you the surgery that was requested by Dr. Shine has been approved. So I'm confirming your appointment on 26th at 1:30 p.m. with the pre-anesthesia doctor.
2 meetings with Dr. Shine before I found out that I was due to have surgery. The first one was a very thorough examination where he examined my left knee to try and identify what the problem was. That resulted in my referral to imaging and an MRI scan and x-rays. Both of these were arranged within 24 hours. I in fact had the x-rays that day.
A doctor who has empathy and a human touch, a person who will explain to you the functionality and how the knee and the ligaments are done, how they function, and he will do a physical test for your knee before telling you or before even looking at the MRI to make sure that what he is explaining and the symptoms and the signs that you have are aligned with the MRI result. And then he will suggest a treatment, and then if the treatment doesn't work, this is when he will take you to the final stage, which is the operation where I am today.
When I was about to head to the operating theatre, I remember there were nurses around me. They actually briefed me what I should be expecting. And I remember as soon as I was entering the operating theatre, one of the nurses told me that I will feel cold. And then I was taken to the operating table, and the team was very friendly. They asked me to announce my name, my age, just to make sure that I was conscious. And I heard music.
So we have our anesthetic side, and then we have our OT side of things.
Relax, take some nice deep breath.
Yes, you'll have lovely music going on, and you're going to wake up to it as well.
He offered me a range of options. One was non-surgical intervention, and the other was a surgical intervention. And after he outlined those, options with me, we decided that a surgical intervention was necessary given the previous damage to my knee and the amount of pain and discomfort that I was in.
Right. This is Dr. Uday. He's our anesthetist. Ryan.
Morning, doctor.
Good morning.
Morning.
This is Ryan. He's the genius who organizes everything. Will not happen without him.
I'm Ryan. I'm scrub nurse of Dr. Shine. So my main purpose here, my main things that I do for the procedure is like during the procedure booking, I make sure everything will be complete. Everything, equipments, consumables, all the implants should be around during the procedure. So I do this like 2 days before or 3 days before the procedure. This has to be done.
So, in terms of the ACL, standard
Yes.
ACL protocol.
We'll start with graft harvesting.
Graft harvesting. She's got a meniscus tear as well.
Yeah.
She's got an MCL injury, but I think the MCL is healed up, so I'm not going to do anything. But meniscus and ACL, definitely.
Okay. So I'm going to induce and stick in a block.
Yeah, I think that will be better. Yeah, block, doing the AD, adductor canal block. Second, pretty straightforward, arthroscopy, partial meniscectomy, diagnostic, and then meniscectomy. His ACL is intact, his cartilage is intact. And so is the next arthroscopy, Alan. Third is the shoulder. She's a doctor. She's one of our colleagues.
Yeah.
She's got a slap tear, and she's Dr. Preeti.
Dr. Preeti.
Yeah. So it's probably most likely going to be a slap repair. Anesthesia-wise, shoulder, scalene block, and the third one is. The fourth one, this one, Shema. She's an arthroscopy as well, shoulder. AC joint issue, impingement related issues. We'll have an assessment of the rotator cuff. If it doesn't need any repairs, I'm not going to do anything. If it's a partial tear, I might just do a stitch, that's all. This is Gabriele. She's not that stressed.
Not too much, just a little bit.
Yeah, so she's had an injury to her left knee, ACL tear, MCL injury, and a meniscus tear. So we've tried to give it some time to let things heal on its own, but I think now we are about 2.5, 3 months, and it's still not steady, and it's a bit wobbly. So the MRI scan has shown complete tear of the ACL and the meniscus. So we're going to try and have a look inside and get it steady for her so she can get back to running and whatever she loves doing. All right?
Thank you.
You take it easy.
Yeah.
Oh, you've already got the Venflon in?
Yes.
That's probably the most painful part of the procedure.
That's
You know
what
that?
I was told, but yeah.
All right. I'll see you shortly.
Thank you.
From this area, we will receive the patient from the ward. So we will check the counter-check, the pre-operative checklist, which is done here in the pre-op bay, in our bay. So this is our meet and greet with the OT team, with the ward nurse. Okay. So from this area, we will move then the patient to the OT.
Alan, may I come in?
Of course you can come.
All right. How are you?
I'm doing fine.
Good, good. So we are
Are we
going.
going live?
Yes, we
Oh,
are.
interesting.
This is Alan. He's had a trouble with right knee. Let me just quickly mark it so that we actually, you can see his tattoo. I'll try and not disturb his tattoo. And it's the right side. And I'll put my initial here. It's the World Health
I'll not take a shower. I have your signature now.
So it's your right knee. This is a bit of a consent form, okay? So we are going in with the camera and having a look inside. Off you go, painless and pain-free. Yeah, yeah, absolutely. There's small risk of infection, bleeding, or stiffness. Anesthesia is going to be general anesthesia with local anesthesia. So most important thing is after the surgery we can get you up and walking, okay? And later in the day, if you feel you're comfortable, you can perhaps even go home. But if you feel that you might want to stay back and you're a bit difficult with pain management, we will make you stay over and then go home tomorrow morning. It's a bit of a long day. We did have a bit of a late start, but I think it's a bit of a catching up now.
My first impression when I came into King's was very friendly staff, starting from the point where, at the entrance where you get greeted. Everybody was very friendly. They guided me to the unit where Dr. Shine was based. I had a very positive impression on the first day itself.
This was my first visit to a surgeon. I had visited King's College before for a general practitioner's appointment. I was very impressed with the cleanliness of the facilities. One thing that really struck me was the friendliness of all staff, not just Dr. Shine, but the Kingsman, reception. Everybody that worked here couldn't do enough to help you. That really impressed me. The speed and efficiency with which I'd got to the point where I had an appointment with Dr. Shine, and the speed and efficiency by which we got to the point to exploring surgical options and treatment were really, really what impressed me. Dr. Shine's demeanour, his attitude, his knowledge, everything was very welcoming, very professional, but at the same time put me at my ease.
So before the surgery, I was in this room, and when I consulted Dr. Shine, he obviously saw that I was nervous. I remember he took a piece of paper and he sketched, the ligament, and he told me there's no other way for a ligament to grow, and the only way is to do a reconstruction. So a piece had to be taken from my hamstring in order to create the new ACL. So he was quite helpful. At the same time, he was informing me, making me aware in terms of what I'm supposed to go through in the next couple of months.
The first meeting was very reassuring. Unlike a lot of clinicians today, I found Dr. Shine Ashokan still relies on clinical skills to make a diagnosis and to plan treatment.
I was in the hospital for 2 nights. I felt I was ready, but I was also very nervous because I had 2 crutches next to my bed, and I didn't know what I was supposed to do with that. Although they trained me how to take steps up and down, I knew that it's going to be challenging, but there was no choice. You just have to jump in and take on the challenge.
Now, the beautiful thing about King College is the people. To be very honest, the people at the reception are always smiling, they are humble, they have a human touch, they have a good communication skill, so you don't feel that you are coming under the knife like a slaughtery. It's a good environment. People have good heart, not only knowledge and skills, but good heart.
I had very little anxiety going into the surgery. I mean, I'd been incredibly well looked after, and the level of professionalism and the amount of information that I had going in meant I had a really clear idea of what the risks of the surgery were, very low risk, and what was actually happening to me. And that actually helped alleviate a lot of the anxiety I imagine myself and other patients may have had beforehand. I was quite calm coming in. The surgical team that prepped me for the surgery were again friendly, welcoming and professional. They made sure that I was comfortable. They explained to me every step of the pre-operation procedure, which really put me at my ease. The ward itself was quiet. The facilities were also top drawer, and every single person that I came into touch with. I was then met with Dr. Shine about an hour before the procedure just to check how I was doing, to talk through any final questions I had, which I didn't. I'd been really well prepared.
Save the best for the last, is it?
Yes. I'll be part of it. You just go through it. Right? So do let me know if there's anything I can help
Yeah,
with.
sure. Thank you. Thank you. So done with the second arthroscopy. Everything went very well. So we're going to take Alan in now. I'm going to just say hello to my fourth patient. She's a doctor. She works with us. Yeah, she's had a bit of a shoulder problem. Painful for the last couple of months. She tried to treat it without any surgery, lots of physiotherapy, hasn't been helping. So I'm going to try and do a diagnostic arthroscopy, and she's got a slap tear, so I'm going to do a stabilization procedure. Her brother is an orthopedic surgeon herself, so no pressure here. I'm just going to say hello to Dr. Krishna. Is Dr. Krishna here?
أول مرة بحس حالي مشهور. جيت على القص. Ciao. I'll see you when I'm back. Exactly.
Come. This is Dr. Krishna. She is having her left shoulder surgery. She's had a bit of a trouble with overhead activities in her left shoulder. MRI confirms it's a slap tear, so we've tried it treating without surgery for how many months? A month almost. So it was persisting pain, so we decided we're going to do an arthroscopy and go in, have a look, and do the stabilization of the repair or of the tear and repair it and stabilize it. So, and then get her going, do all her activities. Right. Good. I'll see you shortly. Okay. I'll see you shortly.
Ibrahim to write everything.
Yeah. She signed it. Just ask her to sign it. Today is what?
21.
For myself, I took the information away and discussed it with my wife. I'd had surgical intervention before, and this was a similar procedure, an arthroscopy. So going into it, I was aware of the risks.
I found that the best way of locating the best specialist in that particular field is to ask medical colleagues working in hospitals. And I asked a number of people, and it was interesting because all of them pointed to the same person, and that was Dr. Shine Ashokan at the King's College Hospital.
It's a bit too high, isn't it? Oh, can the patient go up a little bit? Up a little bit? Okay. Once the surgery is done, most of the patients are received in these bays, and the recovery is done here before they go up to the ward.
Hi, I'm Joanne Robles. I'm the registered nurse assisting Dr. Shine. Every morning before we start the clinic, I run all the list of the patient, just for me to have an overview who are the new patients, MRI follow-up, and procedure patients. We have 2 rooms, one consultation room, which Dr. Shine normally sits. We saw new patients and MRI patients there. We have a procedure room, we saw all the post-op and injection patients.
Need the consent form. So we've done with Mrs. Gabriela. She did fantastic. She's amazing. It went very well. Yeah. We need to introduce Zaki as well. Zaki is our team member who works with Arthrex, and he gives us all the major products that we use for stabilization, shoulder work, knee work. Yeah. So come, let's go and have something to eat. Join us. It's been an exciting day, hasn't it? No hiccups so far. I need to call my wife because it happens to be her birthday today, you know. So let me just give a call. Hello? Hello? Yeah, hi, how are you? Happy birthday.
Thank you.
Okay, did you get the gifts yet? Okay, we are on air at the moment. All the best to you too. Thank you. We'll catch up for dinner. All right.
Okay, bye-bye.
Bye. So it was her birthday. It is still her birthday today. And right. God. Ryan, shall we get some food? Come, guys. What I'm so happy about is that we have a fantastic team set up. It's organized, streamlined so well, so that even if there's some delays, we can make up for it. There's no confusion, nobody's rushing things, so patients are calm, happy. As you can see, he's quite well relaxed.
Good morning. You look much better today.
Yes. Much better today.
Okay,
Yes.
you okay for that?
Yeah, that's
Okay.
fine. Yeah.
You're smiling. Back to yourself today.
Almost.
Almost.
Yeah. Yeah.
Right. How are you feeling?
I'm feeling alright. It's more the swelling that it's like, yeah.
So that's fine. There's a bit of a dressing there, which is a bit soaked. Bit of a swelling here. So we'll change all this. We'll let you have a shower.
Okay.
Change all that after that.
Okay.
And then we'll give you a long double tube grip. Okay. And that's the only one we need to use. It will be long so that we press on the swelling.
Good morning, everyone. Good to see you again. Sorry, I was not wearing my makeup. This is why.
Okay. I'm just gonna take this dressing down. Okay. So.
It's only when I'm doing my.
That's it?
Yeah, that's it. I was imagining like 10 to 15 stitches, blood everywhere.
It's nice and clean. It's nice and clean.
Going into the surgery room was an exceptional experience. They were playing music, so this is something to cheer you up. People were all smiling, and because they started feeling that I'm very nervous, they started cuddling my hair and telling me that everything is going to be okay.
It's all down to the experience I've had, and that's down to the team here, everybody. Knowledgeable, professional, efficient, I mean, approachable, helpful. There's a huge amount of good in terms of my experience. I genuinely can't say enough good things about King's College and every single team member I've been in contact with. I don't remember Dr. Shine asking me. He had Dr. Shine was playing the Beatles in the theatre, and I approved. So that, you know, there was no question. We were both happy, and that's the last thing I remember before being put under.
I'd like to thank Dr. Shine for taking good care of me, being my doctor. Also the physiotherapy center who helped me with movement therapy. My trainer who helped me to get back into track.
Very impressed. Impressed by the courtesy, the professionalism. Things moved smoothly. But most of all, really what told me that I'd taken the right decision as regards the surgery was Dr. Shine, because he inspires confidence. At this level, you expect most people to have good skills, good knowledge, good experience. But I think where he stands out is his caring nature and the empathy. And I think that's in short supply in today's medical world.
Yes, it gives us immense satisfaction to see people doing very well, particularly when they come in so much pain and loss of function and unable to return back to their activities, and you've done something for them and it's changed their lives. So it's an amazing profession, and it's immensely satisfying. However, it does impact us on our private life and personal life. There are compromises that are made, but at the end of the day, when a patient says thank you from their heart, it compensates for everything else. So I enjoy my life and my work. It's a profession that gives so much back to society. And able to keep everyone going, basically. So I'm just going to go and set up the operating theatre for my next case.